Good morning. My name is Jeffry Watson. I'm one of the orthopedic hand and upper extremity surgeons here at Colorado Springs Orthopaedics Group. We'll be discussing various orthopedic conditions in the hand, elbow, wrist, forearm. We'll go over who gets them, why they occur, and a little bit about the anatomy of them, and then most importantly, what's on the menu, as I like to say. What are your options? Once people know options, it helps them to understand and perceive their problem better. So we'll go piece by piece through a number of different topics, and I look forward to seeing you then. This morning we're going to talk about two very common conditions that we see in our upper extremity clinic, and has to do with elbows. And many of you have heard about tennis elbow and golfer's elbow. Well, guess what? Neither of them have anything to do with tennis or golf. They're just human conditions that anybody can get, adults, peak age groups between 30 and 55, and it's usually for no good reason when people get it. About half the patients will have these conditions and they'll tell me something that triggered it. Either a sport or an accident. But the other half of people, they just started having it and it started hurting. Tennis elbow is on the lateral side of the elbow, and golfer's elbow, it's the same pathology within a tendon on the inside of the elbow. And long story why it's one's tennis elbow, one's golfer's elbow, but the real clinical names for these are lateral epicondylitis, of course, and then you guessed it, medial epicondylitis. What happens is all of our tendons in our body are always in a state of injury and repair. Guess what? Your body is constantly quietly going in and repairing little injuries and tears that we get in our tendons, and you never know anything about it. On these two conditions, on the medial and the lateral epicondylitis pathology, they are little degenerative areas in the substance of the tendon, and the body gets behind, I like to think of it, in its repair process. And you have these little micro tears in the tendons. It is not a joint problem, it's not a bone problem, it's not arthritis. It's painful, but it's all coming from this little tiny area, about the size of a dime in both of those tendons, where you get a little bit of softening, fraying, and even tears, all right, will happen in the tendon, and it hurts. When you hold anything, you have to lock your wrist. You don't just hold a jug of milk like this. You always have to lock your wrist, and so it always feels like there's a little gremlin with an ice pick sticking you right there every time you do it. The one on the inside, golfer's elbow or medial epicondylitis, it's a different muscle group, but you'll get that same kind of stab of pain. It seems like it's always waiting for you when you go to do things. Join us next week and we'll review the treatment options for both medial and lateral epicondylitis.